Thank you. That's great walk-up music. I think we walked on stage a little bit early. We didn't rehearse that. And Dr. Boucher, I know you took a peek at all the slides of the other talks beforehand, but we have no slides, and we are near the end of the day. There's only one after us, so I can guarantee you that this will be less than a 3-hour session right now. So just hang with us. My name's Dr. Brad Brown. I am a DPC doc. My clinic's been open a little 3.5 years now, about 30 minutes north of here, actually. And maybe not so coincidentally, I'm also the medical director of Hint Health. And this is Mr. Tony Gambee, who is a serial entrepreneur, as well as a good friend of mine and a patient as well. So we were chatting, and I invited him to come to Hint Summit and share his expertise as a very unique experience as a small business owner, as well as a patient of DPC. I thought it'd be pretty cool. We have we have some time to feel free to ask questions. We'll have some Q&A. Ask him all the questions, not me, and we'll just go from there. So give us a little intro about yourself, Tony.
Thanks. Hi, everybody. I am super privileged to be here today. I've been on the edges of this, learning from Dr. Brad about all this for a couple of years now, and I thought I'd take a minute just to give you a background on how I got involved and how we met. So like he mentioned, I'm a serial entrepreneur. I have a handful of businesses. I have a tech company that's been around for a long time. Our customers are like Ford Motor Company, Whole Foods, don't tell anybody, but United Healthcare. And we're kind of the tech company that would, if you talk to 2 or 3 companies upstairs, we could connect all those together in the background or build something custom. That's the kind of thing that we do on the tech side. Then I have a real estate company. I need to find Jade at some point. I have condos in Vegas, so we need to connect up there. And in 2020, I got bored and decided to open a barber shop, and now we have 3 of them. The newest one is just a couple miles from here in Cherry Creek. And we didn't buy a franchise or anything like that. I just wanted to open something kind of different, and I'll explain a little bit more about that in a minute. But when we first started up in Erie, Dr. Brad and I met each other, and I understood what Strive was, I thought. I didn't lean in, I didn't learn more. I didn't ask about my tech company or anything like that. And I was at a basketball game with a friend, and he told me about his experience with his family and his DPC in a totally other town. And because of that story, I called Brad and I said, okay, explain what's going on here. And I leaned in. But before I tell you the next part of that, I want to just tell you a quick background story of my family. My mom was 16, my dad was 18, they were dating. Both of my mom's parents died within a really short time, and she had 3 little brothers under 10 years old, and a judge actually let them get married and adopt these kids. My dad gets drafted to the war. He goes to the intake office and tells the story, and they send him home after they had done a going away party, all this kind of stuff. So my mom, my dad, as teenagers, were raising 3 little kids in a home that's a few hundred square feet with no plumbing. So growing up, I come from a place of very little financial literacy and stability. So knowing when I had insurance and understanding things around finances in general colored my world on how I wanted to treat people as I became an employer. And that was really difficult for me because I do have employees that don't understand the difference between a premium and a deductible. And those things become important as we get into my story of being an employer who wants to embrace DPC. After my friend told me about this, I called Dr. Brad and I said, let's learn about this more. And my wife and I went into his office, and even with her Doc Martens on, she's almost 5 foot tall. So he immediately apologized for being 6'7", yeah. And we all became friends, and we signed up. We became probably the #1 evangelists of Strive in our area. I tell people about it all the time, and I have real stories because my wife fell off a 4-wheeler in Mexico, and we text like, can we get on a flight? Like, I burned my hand. Like, there's been times when we've really been able to have real benefit and stories related to our experience there. And the most recent thing that we've been able to benefit from is that my first granddaughter was born 7 months ago, and I said to my kids, get in there, this is going to be your care to get you through pregnancy and kind of her being born and stuff. So those things, how it affects my life is significant. And then I want to bring that to my team.
Yeah, that's awesome. Thank you.
Thanks.
And congrats on the baby.
Thank you. I tried to get a picture of her, but I was late for y'all.
We just figured out what we want to talk about 5 minutes ago. So no, I'm just kidding. Cool. So I actually didn't know that story about your upbringing. So that actually connects a lot of dots for me. So thank you. So we, as direct primary care docs and providers, we often talk about our DPC journey, right? And we met pretty early on in my DPC journey. And I think we first met at a small business like chamber meeting or something like that. And you've mentioned before that, hey, I didn't really understand direct primary care back then. And I just chuckle like, yeah, I didn't have the pitch down very good at that point. So I'm glad that you stuck with me. And as I've honed it in over the years. But what about, I want you to expand a little bit on your DPC journey. For obviously you told about personally, but when did you start thinking, hey, this actually could be something as some type of benefit for my employees?
Yeah, I mean, I think that shortly after getting in myself and understanding, and really, I think that there's an early perception that, sure, I'm going to save money, but really it's a convenience. But then I started to actually save money and see that in some way you are like a navigator of the medical system for us. Because when we need something, I don't go, okay, call it in and tell me where to go. You say, let me find the best solution for you, the best option or options. And that guidance became a value that I wanted to share with my team because I saw their struggles as well.
Awesome. You're making my head bigger than it already is. I'm just kidding. Awesome. And so when you started thinking, hey, let's be a little more open-minded about our benefits for our barbers, where did you start? Like, what were you considering? Was it more traditional? Was it like, how did you come about it?
Well, we started with a traditional plan. So here in Colorado, we use Gusto as a payroll company, and Kaiser in Colorado was an easy way to do it. So we just turned that on for people, and we had a handful of people who were like, this is the first chance in my career, and some of them are 30, 40, 50 years old. This is the first chance that I don't have to go to the marketplace and get it coverage. So that's why, as an employer, we wanted to be different. Let's see if we can do that. Can we take care of people in a better way and still make money? And so we started with Kaiser, but people would come to me and say, I don't understand it. They're taking all this money out of my paycheck every month, but then my kid gets an ear infection, and now I'm in debt. It costs me hundreds of dollars to go to the urgent care and for the prescription and tests and all the stuff. And those stories resonated with me as a person who had to come through some of those experiences.
Awesome. Okay. I remember we've had some conversations early on. Tony's a huge sports guy. He goes to all the professional sports teams around here, Nuggets and Avs and everything, and we've gone to a couple games together before. But you've mentioned to me that you do want to stand out for the barbers, right? Because there are a lot of other I guess working class jobs that people could take that half their paycheck goes to not their bank, pretty much, right? It goes to someone else's bank. And so what Tony is not is closed-minded, I'll put it that way. He's very open-minded, and when we started these conversations, a lot of times, for me, I struggle finding the decision maker with small businesses in the local community. I'm like, who can I talk to that would actually have some power in deciding will they send their employees to Strive, my clinic. And you were a pretty quick turnaround. When it clicked, you're like, oh, let's do this. Let's make it work. And so it's a little bit of an outlier because you were ready, you were primed, you were already thinking about it, you were open-minded. But some of the other times for me, I struggle like, hey, it's a 2-3 year runway to get small businesses to sign up, even if they only have 5 employees. And sometimes that's a money thing. Sometimes it's an education thing. So, what would you say to other small businesses? What would be your pitch from a patient and an employer standpoint of, hey, you should look into direct primary care, maybe not as a bolt-on, but as some type of benefit package?
Well, a couple things. We heard it earlier in the discussion. I think it was hemp hill oil. Was that the name of the company?
Yeah.
One of their executives or one of their team signed up, and all of a sudden they had the same personal experience that I was experiencing to become that evangelist, to be a believer. And I think that is an important thing. If you can get one person there to join up and see those tangible benefits is a big step. And then I think for us, there was a point at which somebody said, we will take care of the education of your team. And for me, I have a lot of businesses, a lot of stuff going on. I want desperately to help them grow in some of their knowledge of these things, but I don't have the time or the resources. But we partner with Nextera, and they came in and said, we're gonna provide tools to educate them, and we're gonna get on the phone with them and guide them through this process. And taking that off my plate was a big one.
Yeah, so an administrative thing. Sweet. I just had a question. It was not one that we had prepped, but it was a good one, so it'll come back to me.
All right.
It already left me. Awesome. And so yeah, there are networks like Nextera that take some of that administrative burden off, and that is a good option. Not to plug Nextera or anything, but
it was a trade-off, though. We did talk about this, that there is a trade-off. So we use Gusto for payroll, which brokers the insurance plans and all that kind of stuff. So I had to stop letting them do all the work, and I have to take that on. So it's an administrative trade for me to say, okay, I'm going to do this financial administrative stuff. You take care of the, the education. But it's still like, I never had to think about enrollment when we hired or parted from employees. Like, I never thought about it, and now I have to. But those things, those trade-offs come back. And to answer more, your other question is, I am going to save money and have a more a healthy team because of this. Because I had so many people who would come to work sick, or they'd call in and they would have something seemingly simple wrong, but they'd miss multiple days because they never got any care. They were afraid of the mystery of how much it was going to cost to go get care. I told Dr. Brad a story one time. I was talking to one of the team members, and she said something to the effect of, I'm not feeling great, I'm going to go to the ER after work. And I said, well, wait a second, if you need to go to the ER, you should leave now. And she says, no, I'll be okay. I just a little wheezy, I'll go after work. And what she meant was the urgent care. But even that simple of a concept was so skewed for them as inexperienced of using the medical system.
How has the switch to having direct primary care available to your employees, how has that been received by them?
It's been great for the people who have embraced it. I do have one story. There's somebody who asked me once a month, like, are we still doing this? Am I a member of this? And I said, I don't want to do it. Wait a second. Before you make this decision, reevaluate these things. And every time she revisits it, she's like, oh yeah, I do want this. And she loves to snowboard. She's here in Colorado. And I say, if you go up there and you break your arm snowboarding, it's going to be way less out of pocket for you to come and see your DPC provider than for you to go to urgent care or do any of those things, because it's, they're going to help you navigate that. As soon as you go to this other, to Kaiser or whatever, you're going to have multi-$100 x-ray and services and follow-ups, and everything's going to add up. Just see your DPC. And she's like, oh yeah, winter's coming, maybe I should stick with it. So it does take a commitment for me, but I know that the people who've already engaged with it are on board. It's that one time you need to get them to try.
Yeah. Under the veil of HIPAA, I'm going to try to tell this story a little bit, but I have seen a couple of your employees, and they are amazed that we can do everything all at once. They don't have to fill out a form. What is your most important thing that you want to talk about today? What's the one thing that we can talk about today? They'll see one of the other docs that works at Strive, and they took care of everything that they've had built up for the past who knows how long. Is it a skin thing? Is it a mental thing? Is it anything? You name it, and they feel very taken care of. And so I love seeing it, because once that click happens, it's a thing that sells itself.
And those people are now the next level of evangelists for us to get our team in there, and they are saying, hey, go take care of this. Don't let it build up. And that's what I want to see happen is people pass on, that wisdom.
Yeah, awesome. We want to leave a little bit of time for any questions. So if anyone has any questions, feel free to raise your hand for Tony, preferably. I'm just kidding. But he has a great point of view on being a patient and an employer. So I think we have some microphones being passed around. Alex is getting one.
Hi, my name's Liz. I'm opening direct primary care in January. So I have a couple of small businesses that are interested in joining, and I know that there's some other things like you said, Nextera, but I don't know if that's just here in Colorado or
It's everywhere.
And do they come and talk to them and to the business owners and make a package for them?
Is Katie or Clint in here? Clint, wave your hand. Go talk to Clint in the end. He's right there. Stand up, Clint.
Oh,
He's
great.
yeah, he'll answer those. I'm a huge Nextera fan, but he is the biggest Nextera fan. We'll put it that way. Yeah.
Thank you.
As I understand it, there's a handful of choices like that, and I've found with all of them that I've talked to, they want to help me navigate learning about it, because it's not like the old school thing where it's just like, here's your premiums, here's your deductibles, here's all, like, I don't even know what they all add up to anymore, but the traditional stuff is easy to compare. These things are more difficult, or at least they seemed that way up front. And then you're like, oh, these are real people who are just as compassionate about my team as I hope as I feel I am, and I know that my DPC is.
Did we answer your question? I punted, I'm sorry. Anyone else? In the back.
In the back. Your health plan sounds like it's a health insurance plan, and you bolted on the DPC. Is that about right?
I'm glad you asked. Actually, we had the Kaiser plan through Gusto, and I went to my team and I said, it feels like nobody is using these things because of the mystery of cost and what's going to happen, and you can't actually afford treatment. You can't afford anything. They were treating it like a catastrophic plan. And I said, do you want to, as a team, as a group, we can make this change? So we switched over to DPC exclusively, and they're going to the marketplace for anything beyond that.
Okay, so an ICRA sort of model, like where they go pick their own, they get like a subsidy and they can go pick their own ACA plan, or?
Yeah, so on that side they are.
Okay.
But on the DPC side, I'm administering it all through Hint and Nextera.
That's great. Mm-hmm. I'm a benefit advisor, and I'm trying to help as many small companies integrate DPC into their plan. Medical cost sharing has been a much easier way. Integrating it into a health insurance plan has been much more challenging. And I'm always learning, although we have a good amount of clients. Anyone that wants to share their experiences about how they integrate insurance into DPC is really welcome. So I wanted to just see how you did it.
And we're talking a lot about my barbershops right now because that was kind of the low-hanging fruit for this. But in all honesty, my tech company, I have employees in 4 states, and I've tried a few times to do what you're talking about, but it's been a couple of years. And just at lunch today, I met some people who said that maybe it's time to revisit that, and I'm hoping to do just what you're talking about.
Yeah, the landscape's changing quite rapidly. Dr. Dave.
Hey, question for you. Thanks so much for your experience. I am very curious about your engagement and enrollment strategies. Are there certain specific incentives, educational plans for your employees that helped in those areas of engagement and enrollment?
I don't think I have a good answer for you. It was easy because they went from a couple $100 a month towards Kaiser or whatever it was to I'm splitting the DPC with them 50-50. So everybody's like, great, I just got a couple $100 a month more in my pay, and I can. So Dr. Brad's office is 2 blocks from my one barbershop, so they can just walk around the corner, and the people in the other shops are closer to some of the Nextera locations. So the value proposition was, this will cost less and you will have more access to care. It stopped there. It was pretty easy with that.
It sells itself almost.
Right.
Does that answer your question, Dr. Dave? Thanks. Anyone else? One more maybe? Yeah. I love that the questions are going to Tony. This is great.
Not this time. Hi,
Oh,
Dr.
dang it.
Brett. We run Amity Health in Costa Mesa, California. We just opened in February.
All right,
And
congrats.
I heard you mentioning earlier about your kind of unfinished elevator pitch when you guys first met. And I wondered how that has evolved. We go to a bunch of chamber meetings, and I still
Sure.
don't think we have it nailed yet.
Yeah, no, that's a great question. And anyone on any part of their DPC journey just kind of chuckles, because sometimes, I remember the meeting that we met at, and I went home and told my wife, Danny, who's standing in the back, I chuckled. I was like, man, I kind of botched that pitch. You can just feel when you don't say it the way that you want to, because you're so passionate about it. You know everything, you think you know everything, and then it just doesn't come out right. And so it really is a numbers game of just saying it over and over and over and knowing your audience, because it's a little different if you're having a meet and greet with a young family as opposed to at a BNI or a chamber meeting, right? And so being able to adapt it it just comes with time, right? And reps and being okay botching it and just hoping you have a Tony in the midst who is like, he did a bad job, but I'm still going to go with him anyway.
So a big part of the tech background I do is marketing for some of these big companies, and we were talking about a little bit earlier is remember that the moment you even give your best pitch is not necessarily the moment they're ready to hear it or ready to listen. So be repetitive and find the right time to do that, and also be sensitive to if it's not the right time, just jump ship and talk about sports or the weather, but come back around to it and give people more than one chance to hear those things, because if I'm there and I have an agenda, I'm maybe not listening to your agenda and some of those things. So I would encourage you to refine it for sure, but don't give up on it.
Good question.
Stay connected.
Well, thank you for your time. If anyone needs a haircut before the event tonight, right around the corner.
Right around the corner. Thanks, everybody.